The COVID-19 numbers are increasing at a rapid pace with the Delta variant impacting Arkansas. UAMS Chancellor Dr. Cam Patterson joins us now to talk about the latest numbers and how hospitals are dealing with the surge. Thanks so much for joining us this morning.
Happy to be here.
Yes. All right, I know you're very busy, so can you just let us know, where do you guys stand right now? UAMS stands with the number of COVID patients that you guys have right now.
This morning we have over 70 COVID-19 patients who are in the hospital because of complications. Almost half of those are in the intensive care unit. We have 5 patients today who are on heart-lung bypass to keep them alive. It's a tough situation.
Yeah. What about hospital space? Do you guys have the space for additional people?
Space, we can find space to put patients in. We're very creative with that. We've opened up our 3rd COVID-19 unit to manage our patients. The problem is staffing. Staffing is really tough right now, as you guys reported earlier today.
Yeah. So when do you guys think we're going to see the peak of this surge, or do you even know that yet?
We don't know. That's what's so scary. We've got school coming back in session. Yeah. We still have the Labor Day weekend coming up. I'm not sure that we have a good idea of when the peak will be in sight. Really what's going to determine that is, are you masking and are you vaxxing?
Yeah, and you mentioned masking. We have school coming back in session as well. What do you think needs to happen to keep our children safe?
It's pretty straightforward. Kids should not be in school unless they're wearing masks. We should maintain at least 3 feet, preferably 6 feet distance. If 12 or up, get your vaccination. And you know what? Even if you have kids who are under 12, everybody at home should be vaccinated. That's the way to keep the school safe.
Yeah, so there are some people I've heard, I've been in rooms where people have said, I don't believe any of this. I don't believe these numbers. I don't believe that the hospitals are really filling up and the staff is overwhelmed. What would you tell those people?
Our staff are hurting. We've got an A-level team. When this all started a year ago, it was the first quarter. They were ready to go. 3 weeks ago, it was the 4th quarter. Now it's double overtime.
Wow. So if there are any people out there who maybe are hesitant to get a vaccine, what would you tell them to try to encourage them to go out there and do that?
Hundreds of millions of people have gotten the vaccine across the world and here in the United States. We've got 71 people in the hospital right now because of complications of COVID-19. We've never had 1 patient in the hospital because of complications of the vaccine.
Have you seen any people who have gotten the vaccine and then end up in the hospital as well? Not because of the vaccine, but because of COVID-19?
Because of COVID-19, that happens occasionally, and that's typically people who are immunocompromised. They have organ transplants, they have severe diabetes, renal failure. For the most part, your vaccine is your ticket to safety, and we've never had a death from somebody who's been vaccinated.
So if you can give one final plea to our viewers out there, what would you say to them? I would
actually 3. Get your vaccine. If you know somebody who hasn't been vaccinated, ask them why. And if you see a healthcare worker when you're walking around, pat them on the back and say thank you.
All right, well, thank you so much for all that you do for us as well.
Thank you for getting the word out.